So I'm going to give the opposite recommendation that I do to my students. I tell my students, when you testify before the Congress, don't ask for more money for research. Ask for something to be done for people's lives. But here it's different. And so in every community there's surveys, the Boston Globe, the Baltimore Sun, about life. Most city and counties survey people about life there. I collect them. Not one of them asks whether or not you feel that you're discriminated against in this. So my recommendation is that people who do surveys in communities, whether voluntary groups and others, always have a module which asks you whether or not, 4 or 5 questions, you are being discriminated, for that. Because we build this up, and Dwayne's discussion, and we had this earlier, is a perfect example. He went to the courts over what happened. And so somebody working there could say, oh, there was just one incident. Oh, how did that happen? I believe if we had a county survey, the only difference is that Dwayne felt comfortable about going to the courts about the police. But people at the county or city or the Baltimore Sun level have no simple module, which just says a lot of minorities feel that they are discriminated against. So my apologies for calling for more research, but it would provide some local support for people getting off of it's an individual circumstance to this is what it's actually like in Ferguson. And that, I think there are just a lot of media surveys, community surveys, that you could just add a small module that would raise this issue to.
I want to turn next to Mary because I know that you have to leave very quickly, and we're going to lose your feed. What would your takeaway be?
Thank you. I appreciate you working with my schedule. I think it is this notion of being intentional about addressing the kinds of problems that we saw represented in the poll. And that would mean that creating strategies in employment, for example, in contracting, specifically those 2 I'll stick with, but there are a variety of others that are focused on the outcomes, focused on being able to attach those marginalized and underserved populations, in this case, African Americans, to jobs in tech and clean energy, to jobs in construction if we're seeing communities that are development, seeing burgeoning development. Being intentional about engaging those who've been shut off from good opportunities. I will acknowledge, though, that doesn't get at the mentality and the morality. It's very difficult to legislate these sort of belief systems that go into the makeup of the person who not just associates the microaggression, but might make the decision that affects someone's life. And so for that, it isn't a policy recommendation, but it's a narrative shift. We need to reframe how we look at each other in this society and recognize that it isn't your problem or her problem. It's all of our society, and we all have a commitment and obligation to make it better. Those things that make folks be fearful of someone because of the way they look or dismissive because of the way they talk, we need as a society to work through that so that we are not wasting the human capital that we waste. That's the biggest takeaway for me of this poll. How many people are excluded from society and aren't able to contribute for their own lives, their own families, and for our nation as a whole. It's such a waste. It's such a loss.
Thank you.
Yeah.
David?
I want to build on the point Mary just made about a narrative change. We have research that indicates that both implicit and explicit discrimination is in fact supported by the deeply held negative stereotypes that are pervasive in our culture. So we need a narrative change. We need to change our culture. And that's not an easy thing to do, but it can be done. And it means we need to work with all the agents of culture, not only the news media, but the entertainment media, so that we can start changing the narrative and providing different messages about individuals and groups that are different. And then at the individual level, there's much that we can do. I like to point people to what I call the divine solution. Professor Patricia Devine at the University of Wisconsin has developed, in fact, a program, comprehensive program that not only raises awareness levels and motivates people to be concerned about these issues of discrimination and implicit bias, but has been shown scientifically to be effective in reducing these biases long term. And more programs like that at a grassroots level in communities, so that people get tools and skills can be learned to help people overcome some of these tendencies.
Thanks. Elizabeth?
So I'm a historian, and I think that if we're going to bring about that narrative change that Mary and David spoke about, we really, really need to reckon with our history, with the history of racial oppression, with slavery. I think there needs to be a major educational campaign in our schools across the country to really deal with what slavery actually looked like and its impacts, so that people can understand the ways in which we carry these historical legacies and how racial hierarchies that have defined the United States from its founding continue to pervade our society and prevent us from living up to our basic founding ideals.
Very good. And Dwayne?
I would simply add that our public institutions, whether federal, state, or local, really need to be examined to see where the inequities are in place within those structures, within those systems. Engage citizens in that examination so that we can all contribute to how to repair them so that they work better and they work better together. And in the field of public health, I would love something similar to a Truth and Reconciliation Commission, where we just lift up where we have contributed to inequities as a field to say, okay, that was our past. What is our future going to look like? But just put it on the table so that when we hear about people being afraid of going to receive health care, well, we've contributed to that. Okay, not just us, medicine as well, and others. But that's what I would like to see.